We're really proud of the legacy of the North East working together, the unity across both NHS and our local authorities and many other partners to address, the harms from tobacco and alcohol use. We've got a great track record of working with so many other partners, and it's really important that we continue to do all we can to really tackle the harms from both tobacco and alcohol. So for tobacco, we have made really good progress after the last 2 decades. We've worked with national partners, we've worked across all of the localities here in the North East, and we've worked with international partners as well. And the smoking rate in adults have now halved. But we're not going to let up on that. We know it is still our key driver of health inequalities. There's still some way to go. We absolutely believe now that we can and we should end smoking once and for all, make smoking history for our kids, for future generations. And for alcohol, what we really need to do is have it taken more serious nationally. We've got really good commitment here in the North East, but the lessons from tobacco control are so important in terms of what we need to do for alcohol. We need to regulate the industry. At the moment, there is just not enough regulation. The fact is, alcohol is a Class A carcinogen. It causes 7 different types of cancer. The public have a right to know about this. And in the North East, though, we are concerned. We have half of North East adults are drinking at above the low risk guidelines. So there is definitely things we can do to learn from tobacco control. And what we really need to see is a government commitment to address this as they have done around tobacco. So it's so important that we harness the voice of the North East, our local communities, people who themselves have been harmed, their loved ones have died from either tobacco or alcohol related harm. So it's really important that we say we need national action. We want to really address these. We want to regulate the industry further. These are preventable deaths largely, and it's just really scandalous actually that we have people dying from avoidable illnesses from both tobacco and alcohol.